75 million American women are in some form of menopause right now, and 6,000 women enter menopause every day in this country. But practically no research has been done on treatments for menopause, on what works, on what doesn't. And get this, a whopping 80% of OBGYN residents say they are ill-equipped to even discuss it with their patients. So women suffer in silence. And if you're thinking, I'm not over 40, it doesn't affect me, or I'm a man, it's not my problem, think again. Menopause costs this country nearly $2 billion in lost working time every year. It is an economic issue as well as a profound health issue that will affect every woman lucky enough to live long enough to experience it. Halle Berry was on Capitol Hill to join a bipartisan group of senators on Capitol Hill to unveil new menopause legislation. The bill would provide millions of dollars for research to train healthcare workers and improve treatment options. And maybe the senators could also send a news flash, a hot one, to medical schools in the country, where only 31% of OBGYN doctors in 2022 said they learned about menopause during their residency training programs. That's less than a third. And remember, these are the doctors who are supposed to be experts in women's reproductive health. Joining me now, somebody who's shaking her head right next to me, journalist and menopause advocate Tamsen Fadal, and the Menopause Society president and Ms. Medicine founder, Dr. Lisa Larkin. Great to have you both here. Tamsen, you've been involved in this legislation. This is huge. What are the chances it's going to pass?
Oh, gosh, wow, I hope so, right? The good news is it's a bipartisan piece of legislation and a bill that is just so important. We've talked about this. There are a number of different bills that have been proposed. This one, though, seems really grounded in so many different ways because, as you listed, we're talking about research, education, support, a public awareness campaign.
There's been no research on this. There's none. I mean, we know that in general, women's health gets ignored. All the drug testing, it's all done on men, men's bodies. Nobody does anything for women's bodies. But we have one single study on hormone replacement therapy done decades ago that was halted suddenly that, you know, basically everybody's been running around for decades saying, I'm afraid of hormone replacement therapy because of that study that now is wrong, according to a new article.
Right, repeating that study. And there have been some other little studies that have gone on. But the problem is those headlines were so damaging for women, for doctors, for medical schools, for the public in general. And the truth is, we're talking about, when we talk about menopause, we're not talking about starting at 50 years old. We're talking about 7 to 10 years before you actually hit menopause, you're dealing with these symptoms. Debilitating in so many cases.
Doctor, why are so few doctors equipped to talk to their patients, to their women patients about this? Why do they get so little training?
Well, first, thank you for having me. So this is a huge issue. So since 2002, with the release of the publication of the WHI, the first arm, and all of the media related to that, the news was terrible. Women were terrified of taking hormones, and physicians became terrified of prescribing them. And I will tell you, since that publication, and I watched it in my community in Cincinnati, physicians stopped prescribing hormones. And what we also did, as you just identified, is we've stopped training physicians about the data related to menopause. And so since 2002, we now have 22 years of basically lack of training of doctors and this persistent fear of hormones, even though, you know, the study that just came out again, looking at 20-year data from the WHI, that really is kind of old news for those of us that have been practicing in this space. It doesn't really lead to any new information. But again, that's been the pervasive messaging for the last 20 plus years, even though we've really understood that the data needs to be thought about a little bit differently than it was originally promoted.
Right, but doctor, there was a new study that was just published, literally, I think a couple weeks ago in the Journal of American Medical Association, that found that hormone replacement is safe and effective for treating menopause. And yet everybody still thinks that, oh my God, I'm going to get breast cancer, and doctors won't even talk about it.
Well, so I think you have to be careful about saying that hormones are safe and that the study really says that now. Now, again, I want to be careful to say that what we do know is that it really depends on the age of the patient. And so what we know is the data certainly in younger women between that 50 to 59 age range, the benefits for the vast majority of women outweigh risks. The data in older women, and specifically women who have been off hormone therapy for a period of time, and we use the kind of cutoff arbitrary number based on the data of 10 years, those women start to have more risk. And so it's not a one size fits all. This is part of the reason that it's become complicated.
Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.